We are excited to present our Oncology Pharmacist conversation today, guiding you through cancer care journey for survivors and patients and caregivers, and for patients to understand the importance of the pharmacist role and how they can reach out to a pharmacist and have them really be an involved person on their care team. And that's not always spoken about. And so we just really want to get education around this and the importance of the pharmacist. And so I'm excited that we are joining today with HOPA, Hematology and Oncology Pharmacy Association, and Walgreens Specialty Pharmacy, along with our own CancerBuddy Conversations, which CancerBuddy is our most recent program at the Bone Marrow and Cancer Foundation, and we are a patient advocacy organization here in New York City, and we are our programs are at every cancer center around the country, and we've been around for over 30 years, and we provide financial assistance, mental health, patient navigation, and peer support. And we are just excited to really provide more education to patients and support. So I'm going to go ahead and share my screen and go into the presentation. So can everybody see my screen? Mm-hmm. Great. So as I mentioned, our CancerBuddy app is what we is presenting this today as one of our sponsors, and we are it's in downloadable in iOS and Android, and it's a peer support program and platform where patients, caregivers, and survivors can connect according to their hospital, their diagnosis, their age, their symptoms, their ethnicity, and their location. So it's a great way to connect with other people going through a similar experience. So I will take you through this. So I'm the host, Christina Merrill, and I'm the founder and CEO of the Bone Marrow Cancer Foundation. And I'm pleased to welcome Maria Troya, and she is pharmacy manager at Walgreens Specialty Pharmacy, Westchester Medical Center. And Jabbar Hussain, and he is a clinical pharmacist and specialist at in hematology, blood, and marrow transplant at Mayo Clinic in Arizona. And Shawana Addison is a pharmacist, and she specializes in clinical trial pharmacists, investigational drug services, and pharmacy in Miami at Miami Cancer Institute. So welcome to our guest speakers today. And we're just going to look at the role of a pharmacist. So how familiar are you, everybody on this call, with the role of an oncology pharmacist? And you can do a little poll if you'd like. Take a minute. Okay. So we'll end our poll and we'll share results. So those are our results. So most of you are familiar. Some are familiar, 44%, and not at all. So that's a good sign. Okay. So let me go forward. So who are oncology pharmacists? They are cancer medication experts, training in treatments, personalized dosing and manage side effects, participate in quality and safety initiatives, manage high-cost medications, advocate for patients, provide patient education, including medication-specific education, how to maximize insurance reimbursements, drug to drug interactions, as well as drug food to food and drug supplement interactions, safe storage and handling of chemotherapy or other medications, and how to use medications correctly for the best outcomes. Where are oncology pharmacists? They work anywhere a medication expert is needed, from drug development to clinical trials and treatment management. So I'm going to turn this over to Jabbar to discuss the pharmacist spotlight on bone marrow transplants.
Thank you, Christina. And good morning, everyone, and thank you for having me here today. I'm excited to share with you the role of the BMT pharmacist in the BMT process. And this journey requires, as Christina mentioned, clinical expertise, collaboration, patient education, meticulous medication management, while we strive to ensure the best outcomes for our patients. So BMT, or bone marrow transplant, is a complex process and requires a team. It requires the seamless collaboration and expertise between oncologists, nurses, pharmacists, and other specialists to deliver high quality of care. As pharmacists, our role centers on ensuring that every medication decision aligns with what the patient requires or the patient's needs, so that we can develop the personalized treatment plan and medication regimens. For example, we help tailor chemotherapy regimens based on a patient's condition, organ function, and genetic profile to avoid toxicities. We work together with oncologists to provide comprehensive medication management and therapeutic drug monitoring to minimize side effects, drug interactions, and other complications. Another key part of our role is acting as patient advocates. We work with the various teams, and we stay up to date with the latest evidence-based practices to help ensure that balance between efficacy and safety in treatment decisions for the care for patients. Next slide. And so while teaming up with our clinicians is important in our day-to-day activities, a critical component, though, is teaming up with our patients with direct communication to provide medication education. And this occurs throughout the BMT journey. And because the BMT process can feel overwhelming with complex medications, our role here is to really simplify things in such a way where patients can understand, and we provide clear, tailored education. For example, we sit down with patients and caregivers before the transplant to explain chemotherapy protocols, the role of immunosuppression, the various anti-infection agents that we will prescribe, and how to take these medications. And then similarly at discharge, we go over the same medications once again, review the purpose of these agents, discuss possible side effects and how to manage them. And lastly, we create personalized tools like a customized medication list, medication schedules to help patients remember how to take the medications once they go home and leave the hospital. And these types of medication plans, the personalization, helping patients address their concerns, and that direct communication that we have really empowers patients to actively participate in their recovery. Next slide. And as mentioned, the medication used in BMT can have complex interactions, and careful monitoring is needed to prevent complications. So pharmacists are at the forefront to optimize treatment regimens, and our role is really to maximize the efficacy of the medication while minimizing side effects. We start with understanding each patient's unique clinical profile. We evaluate kidney function, liver function, heart function to ensure patients can safely take the medications and tolerate their medications. We adjust these doses when needed and consider alternative therapies when complications arise without compromising the efficacy of the treatments. For example, immunosuppressant agents and anti-rejection medications are commonly used, such as tacrolimus, and it's important to prevent graft-versus-host disease and requires precise monitoring. Too low of a dose can lead to complications like graft-versus-host disease, while too much of a dose can cause toxicities. Additionally, certain combinations of medications can increase these levels. So by monitoring these levels and discussing it with the overall care team and adjusting these doses proactively can achieve that balance we want for efficacy and toxicity. So by doing so, we achieve our goal where we provide tailored interventions that improve treatment outcomes while mitigating the risks. Next slide. And then even at discharge, the challenges of bone marrow transplant continue, and patients often face long-term side effects, concerns for relapse, infections, and chronic conditions like GVHD. And our role as pharmacists are to guide patients through survivorship and ensure they maintain their quality of life. We help prevent complications through continuous medication adjustments and monitoring. For example, immunosuppressants need to be tapered slowly to avoid relapse. We work with the physicians and guide patients on how that process works. And lastly, patient education and empowerment remain at the forefront, and we provide regular follow-ups to ensure the continuity of care, symptom relief, and a better quality of life. Next slide. And to kind of illustrate the impact of our work, I wanted to share a patient story with you all. So we had a 55-year-old patient that underwent an allogeneic stem cell transplant. The patient was discharged with a complex medication regimen. This included, your immunosuppressants, antifungal, antiviral prophylaxis agents, as well as some supportive care drugs, right, medications. However, she faces challenges with adherence and side effect management, and she mentioned that she's experiencing anxiety about remembering when to take her doses. So to address this, I work closely with her and her caregivers to create a personalized color-coded medication schedule and chart, provide extensive education on each of the medications, such as what it's used for, when to take them, and possible side effects. I also work with the BMT team to monitor her tacrolimus levels to limit the tremors she was experiencing from the medication initially. And I addressed her nausea by recommending an alternative anti-nausea medications as previous ones weren't working. And so as a result, the patient avoided complications such as infections and graft versus host disease and was able to stay on track with her medications. More importantly, she felt supported and was confident in managing her own care. She did express that she would appreciate the impact we have in how we were proactive and provided detailed guidance she received from the pharmacist. Next slide. So now I'd like to take a moment to reflect and ask you all a question. How often do you ask your care team questions about medications? Is it always, sometimes, or rarely?
Okay.
All right, maybe you could stop the poll there. All right, it looks like we're kind of split here. So, 42% of everyone here says always, 33% sometimes, and a quarter of patients or the audience today, it says rarely. And I have noticed many patients do hesitate to ask questions because they may feel intimidated or unsure. But one of our core responsibilities is to encourage open communication, and building that trust is essential for ensuring that patients feel support in their journey. So always feel free to inquire about your medications, and we'll be always happy to answer those for you.
Thank you, Jabbar, for your information. And we now turn this over to Maria. And she is a Walgreens Specialty Pharmacy.
Hello, my name is Maria Troya. I'm going to go over the role of the specialty pharmacist in the outpatient setting. Next slide. The role of the specialty pharmacist, we help manage oral chemotherapy and specialty medications. We're supporting patients with at-home medications. We're ensuring access to medications, as many of these oncology medications are very expensive, and financial reasons could be a limiting factor, as well as the availability of the drug and navigating where the drug is available and how to get access for the patient to be able to have that at home. We also help with medication adherence and side effect management. This is so the patient can achieve the best outcomes, making sure they keep taking their medication as best that they can and have a better quality of life, limiting side effects where we can, and achieving the optimal dose for the patient and their regimen. Next slide. Specialty pharmacists are medication experts in their field. They possess extensive knowledge of complex medication regimens used in oncology, including chemotherapy, targeted therapies, and immunotherapies. We help with clinical decision support, collaborating closely with oncologists to provide evidence-based recommendations for medication therapy management, tailoring treatments to individual patient needs. And we work as a comprehensive care coordination and team. We help the oncology care team facilitating communication between healthcare providers and patients and caregivers. Sometimes we can check in patients very regularly in the outpatient settings, and we can be that connecting loop back to the office to address any concerns, adjust regimens, and keep a closer loop from the patient back to their oncology team. Next slide. We provide personalized care. We do medication reviews, medication histories for the patient in the outpatient setting, making sure it's a thorough medication review of any over-the-counter medications and herbs they may forget to mention at the office, making sure the cadence of these check-ins is regularly for every refill, so we can add and check for drug interactions while the patients are at home. We have patient education, empowering patients through their education about their medication, side effects, proper usage, and they have a greater understanding of the medication. So they take their medication as prescribed, why it's important for them to take it every day. If a side effect is bothering them, we can address their concerns and help minimize the side effect. And it's a holistic approach focusing on the whole patient by not just addressing the pharmacological aspects, but the emotional, social, and lifestyle factors that can influence treatment outcomes. We can recommend in our patient care plans, if someone is having an issue with a side effect, that can involve lifestyle modifications or non-pharmacologic reasons that we can help the patient as well. For our patient story, on the next slide, near and dear to our hearts is a story about fertility preservation in many of our cancer patients, where this can be discussed in the outpatient setting during cancer treatment. We do a full history of the patient and can recommend oocyte retrieval. For this patient story, the case is JS, is a 29-year-old female newly diagnosed with advanced renal cell carcinoma, status post-cytoreductive nephrectomy. The medical oncologist decided on pembrolizumab in combination with lenvatinib, which has the potential to impact her future fertility. JS does not currently have any children, but she wanted to start a family in the coming years. So during JS's initial assessment, it was found that she was not offered fertility preservation at the time of diagnosis. So she was quickly referred to a reproductive endocrinologist for a same-day consult, which resulted in an immediate egg freezing cycle starting the next day. And the outcome was that she had 19 oocytes retrieved 11 days later, and she was still able to start her oral oncolytic 2 weeks after prescribed. So she was able to preserve her fertility for future and start her treatment in an expedited manner. And this is a way that we can help with better outcomes in a holistic approach, treating the whole patient as a female of reproductive age. Okay, for the next slide, we wanted to engage the audience. If you have or are taking oral chemotherapy or other specialty medications, what kind of support do you think you need the most? Understanding the medication, managing side effects, accessing or affording the drug, or remembering to take it as directed? Okay, do we get the poll answers in? And it looks like most most patients would like more information on managing side effects, which I do find in practice as well. We want patients to have a good quality of life while taking their chemotherapy medications, and any ways to manage side effects can improve quality of life and help the patient continue their therapy, which is the optimal goal for the best outcomes. We also do definitely are concerned about financial toxicity, and the cost of the medication seems to be number two.
Okay.
So our next drug spotlight, I'll pass it over to Shawana Addison.
Wonderful.
She's investigational drug services.
Yes, thank you. Next slide, please. So we always ask ourselves, how do we get to a clinical trial? And when I work with my team members who are in the standard of care infusion side, in order for it to be standard of care, it had to start with a clinical trial. So our clinical trial team consists of oncologists, pharmacists, research nurse, and infusion nurses, as well as research assistants and research coordinators. Excuse me 1 second. For our patients, a clinical trial can be the first step for their cancer journey to fighting cancer. Our patients have tried many approved treatment options and agreed to this last final option. So the pharmacist in clinical trial, we prepare the clinical trial site. What that consists of ensuring that we have the right temperature storage, the right space, if we're compounding safely or administering safely. We verify and prepare the clinical trial medications with our technicians. We assess the patients prior to enrollment of the trial, and I'll delve into that a little bit more. So we are not necessarily, our pharmacy team is not necessarily there yet to review patients to see if they can enroll in a clinical trial, but we do review the labs prior to administering or approving a medication. And we also educate the patient on the study medication and trial expectations from the pharmacist perspective, as far as side effect profile and how to manage those side effects. The next slide, please. So for preparation, delivery of investigational drugs. The beautiful thing about investigational drug services with the pharmacist is we have to follow our Board of Pharmacy standards, as well as USP 797 and 800 standards, which is the safe administration and compounding of hazardous medications, as well as what the sponsor wants in a clinical trial. And oftentimes we find ourselves at a crossroad with the sponsor, explaining to them that there are some things that we cannot do due to the safety of the patient and the safety of our team. Our pharmacists are involved in the start of initiation of a study. So we review the protocol, and sometimes those documents are 100 plus pages, and we take protocol language, translate it to pharmacy language, and then we also translate it to patient language. So basically, you could say we're trilingual. And we have a saying, from protocol to infusion chair. It's very easy to say, I want to start a study at your site, but the pharmacists are working with the nurses and the oncologists to ensure that once the patient reaches the chair, everything is good to go. And we do have discoveries along the way, but our team does a dry run before the patient is treated to see if we can put out any fires prior to the patient sitting down, just so they have a good experience, because we do know that it can be a daunting experience to be a part of a clinical trial. Next slide, please. So we do educate our patients on the oral oncolytics, because some of the investigational medicines are considered chemotherapy. We provide how to take the medication, what to do if you miss the medication, if you vomit. We go over potential side effects that you may experience, how to monitor, and let us know what you are experiencing, because we've had this in the clinic before, where we had one patient who wouldn't tell us that he was experiencing a rash on his hands and feet. He didn't want to be kicked off the trial, and what we can do is review the protocol to see if there's a dose modification for the patient. We also do that in regards to our infusion. We don't deep dive in the infusion review, medication review, but we do provide education for the patients. We have patients that come to us and say, I would like to start these vitamins, I want to start this medicine, and we double check the protocol as well, excuse me. And we do, like I said, screening parameters. We review the labs, we review path reports prior to the start of a clinical trial. And we just don't stop there. As every time you receive an infusion or you receive an oral medication, our pharmacy team is reviewing the labs and just making sure everything is good to go. If there needs to be a dose modification, we do present that to the oncologist, who also talks to the medical monitor of the clinical trial, and they have a conversation and we go from there. The next slide, please. So we do have common questions that patients ask. How often do I take my medication? When we are going over the medication review for the orals, we go over that. We actually quiz the patients. We quiz the caregivers to ensure, because for our neuro-oncology patients, those patients with brain tumors, depending on the severity of the tumor, they can be forgetful. So we provide that information to the caregiver as well. How long is my infusion? Because we do have patients that work. We're not ignorant to the fact that everyone can't take off. So we let them know it may be 30 minutes, it may be a 2-hour infusion. And we are an accommodating team to ensure that the patient is able to get treated. What side effects should I know about? Am I going to have a rash? Do I need to stay out of the sun? Is this going to hurt my stomach? Am I going to throw up? Am I going to lose my hair? We answer any and every question that we are asked, and that information comes from the protocol, but we do have a basis of pharmacy knowledge. And the last question, are there any medications I need to avoid? We do have some studies that say you can't have grapefruit, you can't start this medication, but life-threatening situations are understandable, but we don't make those decisions on our own. The oncologist is aware, who again talks to the sponsor of the study, and then a decision is made and we let the patient know. In the next slide, please. So I just have a couple of patient stories. We had a patient over a year ago who expressed her extreme gratitude with the IDS pharmacy team. She was in a neuro-oncology study. She enjoyed the time that the pharmacist took to explain the medication, what to anticipate as far as side effects, and the pharmacist eased the stress of participating in the clinical trial. And our other patient story, because we're located in the beautiful city of Miami, Florida, we do have a lot of international patients that come and they are part of our clinical trials. So we had a pediatric patient from Brazil who parents loved that our pharmacist provided the education and answered all of their questions. What they thought was a small question, she took the time and made them feel seen and heard. So that was really good to hear. And she really took the time to guide us on this long journey for our child. And the last slide, I believe. So just a quick poll question. On a scale of 1 to 5, how comfortable are you with the idea of participating in a clinical trial? 1, not so sure. 2, very uncomfortable. 3, somewhat uncomfortable. 4, somewhat comfortable. And 5, very comfortable. And the results are just to get a taste or a feel. I'm going to give you some time. I don't know if we have everyone result or took the poll, if we want to show the results. Okay. Well, that's expected. That's fine. So 15% very comfortable, 38% somewhat comfortable, 31% somewhat uncomfortable, and 2 very uncomfortable, 15% very uncomfortable. So the next slide, if we could close that. The next slide is we're going to talk about, next slide, please. So this is a tool that HOPA has available to increase voluntary participation in clinical trials for people living in North Carolina. So we are aware that in clinical trials, diversity is a very hot topic, and we would like to see the population of patients that participate in clinical trials reflect those persons that are diagnosed with cancer. So this, if you scan the QR code, it gives you tools. And if you participate in a clinical trial, if you're kind of on the fence, and we're aware that there are myths out there, and it does provide you with answers, like it's a myth buster. We also have the 4 Ws of clinical trial. Who will be involved in my clinical trial journey? What does participating in a clinical trial involve? It can be time consuming, but that is all expressed and told to the patient. Where will it take place? Do I have to travel to Miami if I live in Port St. Lucie, or 2 or 3 hours away? And why should I consider doing this? So if that toolkit there it answers some questions and it guides you along the way, so it can help increase the participation of clinical trials. And I believe that is it for me. Thank you guys for your time and attention.
Okay, thank you. Now we will go to our panel questions and answers. And I'll stop sharing my screen for a minute and we can ask some questions. A question for Jabbar. Can you share an example of how oncology pharmacists collaborate with the broader care team to ensure seamless patient care, particularly during challenging treatment plans?
Yeah, that's a great question. So, in general, we participate in daily or weekly multidisciplinary rounds where we discuss insights on pharmacokinetics, managing comorbidities, and contribute to decisions on supportive care like nutrition, pain management, and psychosocial support for patients. Here we collaborate with oncologists and nurses to review the patient's medical history, labs, risk factors, and we design that personalized conditioning treatment prior to, their bone marrow transplant. This way, we evaluate all risk factors and choose a regimen that allows it to be effective, but also safe for the patient. We ensure that the timing of these regimens align with how it's been studied. And during the process, we evaluate every day how the patient's doing and adjust chemotherapy dose if we need to, and other medications, and know when to maybe stop the treatment for a bit, or hold the dose, or add additional medications to allow the patient to continue to stay on track throughout the course. So it's very collaborative in a sense, and it really requires a team of professionals to really discuss with the patients, talk to the patients, and come back as a group to decide, from an overall standpoint, what is the best way to proceed so that the patient's comfortable, safe, and still achieve success at the end of the day after the transplant.
Okay, great. Does anybody have any questions on what Jabbar just spoke about? Okay. So then we have another question we'll give it to Maria. What strategies have you found most effective in supporting patients to adhere to their medication regimens, especially when managing complex oral chemotherapy or specialty drugs? No, you're muted, Maria. There you are.
Sorry. So medication adherence and the complexity of treatment are a common question and issue that arises during treatment. And we found that the best outcomes for patient, we start at the initiation of therapy. We do an initial assessment, and we look for any potential barriers to treatment, which include any barriers to adherence. That could be the cost of the medication, side effects that could potentially hinder treatment once they start, and the complexity of it, how many capsules they have to take a day, the timing of the medication multiple times a day. So if we notice any of these that would arise for financial assistance, there's patient assistance programs that we help people sign up for. We have a variety of applications that can search for grants that the patients can qualify for. And we want to make sure that we also can see and make sure that this can get through prior authorization if needed via the insurance. And then after the insurance aspect, it could still be a high cost. And the patient assistance programs out there are very helpful to help make sure that financial reasons aren't a reason to limit people from not taking their medication. The second most common issue with adherence is side effect related. And we make sure the best way to reduce side effects with their medications being implemented, we tell them the best way to take it to minimize the side effect, whether that be taking it on an empty stomach so they don't vomit right after taking the medication, maybe better taken on an empty stomach, or if we can help see if this is a high emetic therapy that maybe they need to have certain anti-nausea medication prescribed before starting the medication, depending on the drug. These are things that we can do to help make sure that the side effects aren't a limiting factor and make sure the patient can reach that balance between achieving the best dose or limiting side effects and quality of life and being able to continue their medication regimen. The complexity of the regimen itself, just remembering to take the medication multiple times a day, the cycle timing, whether they're on a 28-day, 21-day cycle and they need to take days of rest, or whether it's multiple times a day, just remembering to take the medication. We found that there's many tools helpful. We generally recommend pill boxes. We also recommend, now that there's so many technologies out there, putting it in a calendar with notifications, alarms. We find these to be very helpful. It can also help caregivers manage it. If they have to manage it remotely, they can check and see if their caregiver has, if their patient they're assisting has taken the medication. And we as pharmacists in the outpatient setting check in on the patient 10 days after initiation to see how they're doing on starting the medication. Did they start the medication? It's 10 days out. How are they doing on the side effects? Do we have to address any side effects to make sure they're continuing to take the medication? Did they just take it a couple of days and they said, I don't like this medication? We have to alert their oncologist and their oncology team to, get them on a better dosing, see why they don't want to take the medicine so they can continue therapy, because we want them to have the best goals possible. And then we continue to do these interventions and check for these warnings of not taking medication or medication adherence barriers at the refill call and follow-up calls every refill and every 6 months as well.
Okay, great. It's such a valuable information because patients do struggle with side effects and then not wanting to take their medications because of that. And it's great to know that you as a pharmacist are involved in that process to alert their oncology team and of that nature. We have another question for Shawana. What are some of the biggest challenges in managing investigational drugs during clinical trials? And how do you ensure patient safety and understanding during this process?
So the first question, one of the biggest challenges that I believe our site faces is getting truly an understanding that we don't know everything about this potential medication that we will hope to be approved. So we have to keep the open lines of communication between the patient, our team, as well as the oncologist. So any small, minute thing that you think is a little minor detail, it can be a major detail for us, as well as the sponsor who is providing the study, to update and add this to the potential approval for that information. So we're actually in a dark area and we're feeling our way around because it's a trial. And the second part of your question, if you can repeat it, please.
Yeah. And how do you ensure patient safety and understanding during this process?
So during the study startup, when we are reviewing the protocol, there are some things that we do know as pharmacists or oncology pharmacists, because some of us have worked in standard of care oncology. There are certain things that stick out to us. Like, I know this medication group is going to cause cardiotoxicity, it's going to affect your heart, it's going to cause increased nausea and vomiting. So when we are talking to the sponsor and that information was not in the protocol, we bring it to their attention. For what we know and based on our practice experience, this medication can cause nausea and vomiting, and it's very high. So it is okay. Is it okay with you? Because we're going to add these medications for these study medications? And it's usually always 100% yes, because our team is very convincing. We have a convincing group of women pharmacists and one male pharmacist, and we don't let anything go because we fight for the patient safety. So we are strong advocates, and we just don't back down.
That's good to hear. And we have another question that any of you can answer. How would you instruct a person with cancer or their caregiver to get a hold of an oncology pharmacist if they are unsure if they even have one? Like just at the hospital, like, when they're administered their medication, or they're just starting chemotherapy and they're just new to this whole new journey that they're on. How would you advise them to get their pharmacist involved?
Yeah, absolutely. I think the best approach that I've seen a lot of patients do is just really just ask the nursing staff or even their provider. They simply call in or send a message to the portals like, I've heard about oncology pharmacists. Do you guys have one? And if so, can you connect me? And then oftentimes, we get a message from our coordinators or even providers, physicians and oncologists to reach out to the patient and answer any questions because they mentioned that they would like to speak to oncology pharmacists. So I found that those avenues really allow access for patients to speak with myself and other oncology pharmacists.
Okay.
And also, to piggyback off what he said, our site, we actually have pharmacists that are in clinics, and those pharmacists are very familiar with the patient. They call the patient for the oral chemotherapy. They provide counseling as well as our specialty pharmacy. Our research, our clinical trial pharmacists, we're right next to the infusion suite. We go out and talk to the patients all the time. We see them in the elevator in the morning. So we are readily available, and every clinical trial patient does receive a card that say they're in a clinical trial. We provide our pharmacy phone number. It is on the labeling of the oral medication, and our research team coordinators and nurses, they send us emails. They know how to reach out to us, and we do not hesitate to talk to the patient about anything.
What about if a patient is, eating certain foods or taking certain supplements, and they're working with a nutritionist, and they just want to, collaborate with the pharmacist and the nutritionist that's involved? Are you open to that kind of communication with with a nutritionist to step in and have that discussion with you directly?
Yes, for sure. I will speak to our site that we always let the patient know, please do not leave your other physician in the dark. Let them know this is the clinical trial, this is the oncologist, their phone number, and we are a very collaborative practice group, and we're open to that. We would prefer that, because what we would hate is for our patient to not be able to continue the trial for something so small and minor that could have been solved in a conversation.
Mhm.
Yeah, I would agree with Shawana as well. It's a team effort, and collaboration is key. And so yeah, we work with variety of specialists, and working with dietitians and nutritionists definitely help um, the overall care of patients. And I'm always happy to coordinate certain supplements and oncology medications to make sure that it's safe for the patient.
Mhm. Thank you. And then we have one more question. How do you approach educating patients and caregivers about their medications? And what common misconceptions or knowledge gaps have you encountered? This can be for any of you.
So in the outpatient setting, when we're having someone start on their medication at initial assessment, sometimes we like to go over the goals of therapy, and I find that there's a gap there. They may not really know what their baseline is right now and what their goal of taking this medication is. And usually it's progression-free survival, and what that looks like and what the physicians are going to look for on their next scan, things like that. And that can be helpful for the patient, because sometimes I think they're a little confused about what their goals can be, and like, what's the reason? What is this chemotherapy or oncolytic going? How is it going to help me in the future? And gives them more reasoning to be compliant and adherent and take their regimen.
Okay.
Yeah.
Go ahead,
Oh
Jabbar.
no, I was just going to suggest, uh, to approaching educating patients and caregivers, it's once again creating that environment where it encourages questions and addressing concerns. And even if patients sometimes don't even have questions, I bring up common misconception or common questions that I receive on a day to day, and that often sparks those ideas and the questions that they may have that they didn't even know about. So it's just about that slowing it down and pausing those questions and encouraging that. It kind of helps.
Okay, great. And I was going to open it up just to anybody that's joined us today, if anybody has any questions, for you three. So I guess we'll just give it a minute to see if anybody does have any questions or want to ask anything specific about their own situation or in general. Joyce. I don't know if anybody is wanting to ask any questions, which is okay. Let's give it a minute. Okay, I don't know. Let me see. Oh, here from Maria. This is from Amanda. What system, how do you communicate with the prescribing doctors from various locations?
Unmute myself. That's a good question. So in our facility, we're lucky to have Tiger Text, which is an internal texting communication, which is very helpful for us. But for outside locations, we generally communicate via phone or electronic communication, such as fax. We can email encryptedly, but it's generally done by phone. And we're available, our office is available Monday through Friday, 8 to 6 p.m., but there's Walgreens nationwide available should we be closed to field any patient questions for their specialty pharmacists. But with medical offices, it's generally done by phone. If we're fortunate to have technological communications that are encrypted, which is easier to speak with the offices for sure, we use that method because it's faster, but we do communicate usually by phone. Does that answer your question?
Yes, it does. Okay, let me see if there's anybody else. Not yet. We'll give it another minute. We have a few more minutes till the end of the webinar. Okay. Uh, okay, well, I'm not sure if there's any more questions, but this has been very informative and really is a good educational, information for patients and caregivers and professionals to just know the role of the pharmacist and how important it is to this overall patient care and how they can, reach out and ask for their involvement in their team. So I really appreciate everybody being here today, and thank Shawana and Maria and Jabbar for being here to answer these questions and help educate our community. And thank HOPA and Walgreens for their involvement with us. And if anybody wants to meet peers, the app is a great way to do so, to meet others going through a similar experience and making cancer a little less lonely for everybody and helping with support and education. And we have groups, support groups on the app. And so it's a great way to just find some support even when you're sitting in a hospital room or receiving chemotherapy or, being at home or isolated and so forth. So it's great for that reason. So thank you, everybody. Thank you, Maria, Shawana, and Jabbar. And if there's no other, I guess we'll just end a little early. And thank you to all of our viewers that came on
How about breakfast? It's still warm.
No, I ate breakfast about.
All right.
Yeah.
Hmm.
Anyway, okay. Well, thank you guys.
Thank you for having
Bye.
us.
Thank you.
Thank you. We'll do it again in the future. Bye.
Right.
Bye. Thank you.
Bye.